guys, my name is Raval. I came today with one more new blog. I'm staying in Bangalore, Sarjapur Road, and this blog is related to one of very good child specialist doctor, Dr. Prashant P, and his clinic name is DYU Women and Child Care. You can see here, this is the clinic name. Also, this doctor, Dr. Prashant P, is head of department in Motherhood Hospital, Sarjapur Road. So this is located in HSR layout, just nearby MACD signal. And I'm just entering to the clinic. This clinic looks very beautiful and very nice. You can see the ambience here. This looks very fresh. We have a good sitting arrangement. We have a medical shop inside this, and washroom, all the medicine available here only. And we can go to the reception, just we'll get some idea what are the services they provide and what is the fee. So hi,
Hi.
after shooting for, we saw the clinic and all the ambience and everything. Now we are with Mr. Prashant, Dr. Prashant P. He will just give the details about the clinic and facility they provide and about his experience, and if he want to give some suggestion for the child and parents, especially in this changing weather. Yes, sir.
Yeah, hi. First of all, thank you for coming and shooting here. And this is a very unique space what we have created here. This is a combination of both women and child wellness and issues which we see in both women and child, and also men as well. So this is a clinic which has got, this is the first clinic in India to have India's first baby spa, which we started in 2016. So we do have baby massage, baby manicure, pedicure, and baby stimulation. And here in this clinic, we also have child development center, where we deal with all special kids or kids with certain specific issues like attention deficit or hyperkinetic or very active aggressive kids, mobile de-addiction. We do a lot of things here. And we also have, related to women, we have India's first gynec cosmetology center, wherein we take care of post-delivery. A lot of changes happens like stretch marks, pigmentation, and a lot of body transformation both within the body and outside the body changes happen. So we do have equipments which will help in reshaping them and giving a complete mommy makeover. We have a chair called Emsala chair, which is a US only device in entire world which is US FDA approved for for the purpose of because of the pregnancy and because of the hormonal changes, there will be pelvic muscle laxation which happens. So if you sit on this chair even with the clothes on, it will give 12,000 pelvic floor contractions, which will help in strengthening the pelvic floor muscles, and in turn help in reducing urinary dribbling if any woman has urinary dribbling problem. And it also helps in vaginal rejuvenation. It also helps in preventing uterus prolapse as well. So this is a wonder chair for women, which will act like more like a pelvic yoga, and in men which will help in enhancing if they have erectile dysfunction or longevity of erection issues are there. If you sit on the chair, because most of the men or couples, they do seek all this fuel shop services, but here this is a US FDA approved chair what we have, which is completely safe without any side effect, which will enhance the blood flow of the pelvic floor muscle and also strengthen the pelvic floor, which in turn helps in good sexual function as well. We do have what is called as M-Sculpt Neo. This is the celebrity favorite and very effective and US FDA approved machine, which gives 20,000 abdominal muscle contraction or abdominal muscle crunches, which helps in reducing with 4 sessions. It helps in reducing belly fat by 4 to 6 inches. And this is again US FDA approved and used by everybody, most of the celebrities across the globe. There are 10 lakhs users in US, and in India we are one of the pioneers to introduce this technology. In entire South India, only we have this equipment and machine, and we do have a smart IVF center, wherein from end to end we have smart facilities where the entire process of IVF is in time-lapse video recorded, so that will help in choosing the best sperm, best egg, and best embryo. And entire thing is we have a software and hardware, and we have nanotechnology, robotic arm, which helps in doing ICSI, where the sperm is injected into the egg, and we are the only one, and we are the first at this point of time to have this smart IVF center. Literally, it is smart in every aspect, which will help in enhancing the result or doubling the result. The industry standard of 35% success rate IVF, because of this robotic technology and smart software and hardware combination what we have, which will enhance the results to 75%, and we have been successfully doing from last almost a year. And we do have cosmetology services, like instant celebrity glow if you want. We do have US FDA approved machines. We have jet peel, which is again which gives instant hydration and instant changes you can see. So basically head to toe makeover, and will make you look 10 or 15 years younger, and make you give your skin a new life and new energy, and all these services in one single roof. And we are the only center in India to have technologies like laser technology, electromagnetic IFM technology, and radio frequency in treatment of cosmetics, all in one single roof, bundled up to make you look beautiful and good, with pediatric consultation, vaccination, baby spa, child spa, baby swimming. We do have kids, 11 days kid swimming in our baby spa, and 8 months baby before they crawl they start swimming. So all these unique facilities we have created here for the people of Bangalore, and thank you very much, and you being part of our care. Thank you very much for shooting this.
Yes, thank you, sir. And why I decided to shoot this, because my personal experience with you was great. My child was in little bad shape, and finally, with your support, we could make him very happy and healthy child now. So, sir, one question, like as you explained us about the whole process, do you do this alone, or you have your team?
We do have a separate cosmetic team, which includes a cosmetologist, a dermatologist, gynec cosmetologist. My wife is one of the India's few gynec cosmetologists and IVF specialists, and we do have cosmetic technicians. This is cosmetic part. For baby spa, we have a doctor, we have a trained nurse. We do have a separate infection control policies, like how we handle OT and ICUs. We're handling our baby spa. And for pediatric and pediatric related expertise, I'm there. And we do have other child development team, like speech therapists, occupational therapists, physiotherapists, psychologists, psychiatrists, developmental pediatrician, a complete set, different departments and different teams who are handling this. So in that way, the care is given at the best possible way.
Answer one more question, which will be very relevant for many parents. In Bangalore urban, so many new people becoming new parents, who and all are not very familiar with their child, how to take care and other things, and they get very tense for small issues happens with the baby. So any suggestion for them, how for the newborn baby, how if people don't know what other things are normal, how to take care of them?
See, first thing I would like to tell them that your entire process of pregnancy, in this present scenario, it is monitored from the time you conceive, from the confirmation of pregnancy, where the zygote goes and attaches to the uterus. It is monitored by ultrasound, and throughout the pregnancy, every bit of baby fetus is scanned. Their heart is scanned, brain is scanned, their entire process of labor is scanned, and entire pregnancy is delivered in a hospital with a beautiful backup and setup. The entire 9 months of baby is monitored. So once if any problem is there, most of the time it can be detected before baby is delivered. So if everything is fine, it is assured that your baby is fine, because 9 months we have monitored. It's not like one time. Once the baby is born, we do again. It is delivered in a hospital setting. So again, baby is again examined, again monitored. So you don't have to worry about any major concern, because it's already taken care. And then we discharge you to home. The only thing what we advise when we discharge you in first 10 days is to look for jaundice. So for that also we call you 2 or 3 days of discharge, and we do check in first 10 days whether jaundice has gone up or not. If it goes up, we do give phototherapy, admit and give phototherapy. Post that, you have to only focus on feeding, burping the baby nicely, and keeping the baby warm. If you do this basic things, and you don't have to worry about any other uncommon things, because the rare things are always rare. What I'm telling is common things. So common things are always common. If you feel that baby is not feeding well, if baby is not gaining adequate weight gain is not there, then you can seek our advice, and which we would have scheduled an appointment post delivery, and for vaccination and for the regular follow-up. So if you keep on doing that, that itself will solve majority of your problem. And you should not worry when you are in this era of you get doctors online, you get doctors next door, you get so many nursing homes. Please don't worry as a new parent. And there is so much of information which is available online as well. But read what is positive, don't read rare things. So that is the only advice which I would like to give.
Thank you for that, sir, and it was nice talking to you. Surely, with this video, many people will get benefited, and they will not get tense for small issues. And of course, if you can share some of your experience, like about your work and about your background, sir, just for the viewers to be little confident about.
Yeah, see, I have done my MBBS from Bangalore. Then I've done my post graduation from Assam. I've done one more post graduation from Bangalore. I've done my MSc neonatology from UK Southampton University. I've done my executive MBA from Harvard University. I've done my postgraduate nutritional training from Boston. Then I've done my point of care ultrasound training from Johns Hopkins. So basically, I have been training, and I love learning new things, and I've been a faculty, national faculty for many conferences, and international faculty as well. So my only suggestion is all our degrees will go into dustbin if you are unable to understand the parent, not just being a doctor, but being myself, parent of 2 kids. So what we read and what we practice, there's a huge difference. Reading is for basic foundation to understand the science. Practice is about the combination of, we have to bring in our expertise as a pediatrician, as a parent, and as a socially responsible person. So if we club all these things in a doctor, I'm sure the patient is, the kids and the patient, the wonderful soul is going to get benefited in a very big way. So my experience is about combining all the things and giving the best possible for the little beautiful soul whom we are treating.
Thank you, sir. Thank you so much for giving us time, and thank you so much.
Thank you.